Hello everyone. So today we are going to talk about various false positive of the VDRL and what are the various conditions where the VDRL shows the false positive reports and various lab investigations of the Treponema pallidum, and we will also talk about the Jarisch Herxheimer reactions. So first of all, let us talk about the uh, brief about the VDRL. So VDRL, the short form of the full form of VDRL is Venereal Disease Research Laboratory. So the VDRL detects the non-specific antibody, and the VDRL is quantitative and it is also inexpensive. So it is widely used in the various laboratory. The VDRL is sensitive to syphilis, but it is not very specific. In the syphilis, in the primary syphilis, so in the 80% of the cases the VDRL is positive. So in the 80% of the cases the VDRL is positive. So now let us discuss what are the various cases where there is false positive report of the VDRL. So the false positive report of the VDRL could be in the pregnancy, the various viral infection like Epstein-Barr virus and hepatitis viral infection, various drugs like chlorpromazine and procainamide, the rheumatic fever, however it is very rare, in the lupus and leprosy. So these are the various conditions where the VDRL are positive, but actually this is not the disease condition, or there is not the active disease of the syphilis. Now let us talk about the various lab investigation. So the lab investigation there that are divided into two types of the treponema. One is direct testing and another is serological testing. In the direct testing, we can directly visualize the spirochetes by the dark field microscopy, and we can also detect them by the polymerase chain reaction. And in the serological testing, it is again divided into two types. One is non-specific type and another is specific type. In the non-specific type, we call this non-treponemal serological testing, or it is non-specific serological testing, and another is specific serological testing, or we also call it as treponemal serological testing. So in the non-treponemal test, it is RPR test and VDRL test, rapid um, plasma reagent, and VDRL, Venereal Disease Research Laboratory, and the treponemal test FTA antibodies, that is fluorescent treponemal antibody and TPPA, treponemal pallidum particle agglutination test. So the RPR and VDRL are the non-specific test, that means non-specific non-treponemal serological testing, and FTA and TPPA are the specific treponemal serological testing. Now let us talk about the Jarisch-Herxheimer reaction. So this is the specific type of reaction we see when we kill the bacteria that is present inside the any person after the administrating them any antibiotic. So we suspect a person that is suffering from the syphilis. So especially any person that are infected with the spirochetes. There are various type of spirochetes. I told you there could be the Lyme disease, there could be the leptospirosis, or there could be the syphilis. So when we start the antibiotic, the bacteria are killed. So this Jarisch-Herxheimer reaction are especially seen in the spirochetes. So after their death, this type of bacteria releases the toxin, and we see the various flu-like syndrome. The various flu-like syndrome includes fever, chills, headache, and myalgia. So we see this flu-like symptom after we give the antibiotic to those who are especially infected with the spirochetes. So this constellation of the syndrome, we call it as the Jarisch-Herxheimer reaction. So in this topic, we discussed about the various false positive VDRL. You have to know that in pregnancy, viral infection, especially in the Epstein-Barr virus, hepatitis, and in drugs like chlorpromazine and procainamide, in rheumatic fever, lupus, and leprosy, the VDRL could be the positive. And the lab investigation is divided into two types: direct testing and serological testing. And we also discuss about the Jarisch-Herxheimer reaction. We see the flu-like syndrome like fever, chills, headache, and myalgia to those who are we start antibiotic and who are infected with the spirochetes bacteria. I hope you understood this topic on VDRL false positive and the various lab investigation of spirochete and Jarisch Herxheimer reaction. Thank you.